Hello everyone. Today we are going to study orthopedic disorders of the wrist. First of all, let's learn the anatomy of the wrist. Wrist is made up of radius, ulnar, plus 8 carpal bones. 8 carpal bones are grouped into a distal row and a promixal row with 4 bones each. The promixal row includes the scaphoid bone, lunar bone, trapezial bone, and pisiform bone, while the distal row includes the trapezoid bone, capitable bone, and hemitic bone.
Here is a catchy phrase: Zoozoi capi, ham scap luna trapezi. Now, let's explain the wrist joint in detail. The trapezium bone is in the base of the thumb. The pisiform, the sesamoid bone of the flexor carpi ulnaris, does not form wrist joint movement, but can increase the ulnar flexion. The articular surface connecting the scaphoid, lunar, and triquetral bones and the distal articular surface of the radius form the radiocarpal joint. The scaphoid bone is the longest and largest piece of wrist bones in the proximal row, which is boat-shaped and consists of 3 parts: tubercle, waist, and pole. Its distal end exceeds the proximal row of wrist bones and reaches the medial of the capitate bone, and its waist is equivalent to the plane of the joint below the 2 rows of wrist bones. The scaphoid bone articulates with the distal radius and 4 of the 7 wrist bones, the surface of which is mostly covered by articular cartilage, except for a small part of the dorsal side and the palmar scaphoid bone tubercle, where there are ligamentous attachments providing the entries of nutrient vessels. The wrist bone mainly rely on the blood vessel in the palmar and dorsal ligaments for nutrition. Wrist joint is composed of 3 joints: radiocarpal joint, intercarpal joint, and distal radio-ulnar joint. Therefore, it is the most complex joint in human body. This complex structure is often beneficial to the exertion of hand function. First, let's learn about the radiocarpal joint. The radiocarpal joint is formed by radius, scaphoid bone, lunar bone, and the triquetral fibrocartilage, and ulna is not directly involved. The articular capsule is thin and lax, and it is reinforced externally by palmar radiocarpal ligament, dorsal radiocarpal ligament, radiocarpal collateral ligament, and ulnar carpal collateral ligament. The radiocarpal joint is a biaxial ellipsoid joint, capable of multi-axial movement with a range of motion of 60 degree to 70 degree in flexion, 45 degree in dorsal extension, 20 degree in abduction, and 40 degree in adduction. The second part is distal radio-ulnar joint, which is formed by ulnar notch of radius, annular articular surface of ulnar head, and triangular cartilage. The joint is reinforced anteriorly and posteriorly by the distal radio-ulnar anterior and posterior ligaments. Distal radio-ulnar joint combined with proximal radio-ulnar joint allows the pronation and supination of the forearm and hand. When the forearm pivots, the radius rotates around the ulnar head and the ulnar head as the center. The distal radius forms are articular surface with scaphoid bone and lunar bone, and its dorsal edge is longer than palmar side. So the articular surface inclines to palmar side by 10 degree to 15 degree, which is called palmar tilt. The lateral styloid process of the distal radius is 1 to 1.5 centimeter longer than its medial side. So its articular surface is inclined 20 degree to 25 degree to the ulnar side, which is called the ulnar tilt. Third, intercarpal joints are composed of multiple joints, including joints of the proximal carpal row, joints of the distal carpal row, and metacarpal joint. First, the proximal intercarpal joint. It is formed by scaphoid bone and lunar bone and the triquetral bone, and the triquetral bone and the pisiform bone. There is no independent articular capsule between scaphoid bone and lunar bone and triquetral bone. But adjacent bones are connected with palmar intercarpal ligament, dorsal intercarpal ligament, and medial carpal ligament. Between the pisiform bone and the triquetral bone, the pisiform bone joint is formed with a separate articular capsule and articular cavity, while the distal intercarpal joint is formed by the trapezium bone and the trapezoid bone, the trapezoid bone and the capitate bone, and the capitate bone and the hamate bone. The four carpal bones are connected to each other by 3 intercarpal ligaments, and to the proximal carpal bones by means of the volar carpal and dorsal ligaments. The medial carpal joint, also known as the transverse carpal joint, is located between the proximal and distal carpal bones. It is a synovial joint formed by the capitate bone, hamate bone, and scaphoid bone, lunar bone, and triquetral bone. The lateral part is convex to the distal side and formed by the trapezium, trapezoid bones, and scaphoid bone, which is a plane joint. In terms of the intercarpal joints movement, proximal and distal intercarpal joints are capable of only minimal gliding movements, whereas the medial carpal joint has a large range of movement. In conjunction with the radial carpal joint, it can increase the range of flexion, extension, abduction, and adduction of the wrist. Apart from the bones and joints of the wrist, there is another important part to be studied, namely the carpal tunnel. The carpal tunnel is made of the carpal bones and the overlying carpal palmar side and strong flexor retinaculum. Inside the carpal tunnel, flexor digitorum superficialis, flexor digitorum profundus, the common flexor sheath, the flexor pollicis longus tendon, its tendon sheath, and the median nerve pass through. The median nerve runs inside the carpal tunnel between the tendon of flexor digitorum superficialis and the flexor retinaculum. Because of the small space it is located in, it is easily compressed against the ligaments and damage, causing sensory disability and dyskinesia in the distribution area known as carpal tunnel syndrome. Next, we are learning about the special examination method for the wrist.
Fingerstring test. During operation, ask the patient to flex the thumb, then wrap fingers over thumb. Then the patient performs a ulnar deviation after making a fist. to stretch the tendon sheath of the radial styloid. If there is pain in the radial styloid, it's positive. Compression test of wrist triangular cartilage. Ask the patient to sit down during operation. The examiner holds the patient's lower forearm with one hand and grasps the patient's hands with the other hand. Apply a force with the wrist to extreme palmar flexion, splashing, and ulnar deviation. Then apply pressure to rotate to press the triangular cartilage. If there is pain in the distal ulnar side, the test is positive. Indicate injury to the triangular cartilage. Scaphoid percussion test during operation. Radially deviate the affected hand. Percuss the head of third metacarpal bone. Exert pressure in the direction of the scaphoid bone with the metacarpal bone. If the scaphoid bone is fractured, severe percussion pain can be produced. Sometimes severe pain can also occur when the head of the second metacarpal bone is percussed. That is a positive sign. Carpal tunnel tenacious test during operation. Slightly percuss the midpoint of the proximal margin of the flexor retinaculum on the palmar side of the wrist. If abnormal sensations such as tingling and numbness in the affected finger appear and intensify, it's positive. It suggests the carpal tunnel syndrome. Phelan test during operation. Rotate the wrist joint to palmar flexion. Compress the median nerve for 1 minute at the same time. If the symptom of the affected finger worsens significantly, the result is positive. It suggests the carpal tunnel syndrome.
Now, we are learning about the imaging of the wrist to further clarify the diagnosis. Well, that's all for this lesson. I hope you can review it well after class. Thank you.